asking to join the right.
Shri Dhanvantariye Namaha. With the blessings of Lord Dhanvantari, myself, Dr. Mamta Jwalikar, Associate Professor, Ayurved Mahavidyalaya Hubli, extend hearty welcome to one and all for the national webinar on Sroto Anveshana, which will be streaming live on Facebook. We are fortunate to have such an eminent, wonderful panel of speakers from different vesticles. Today we have Dr. P.S. Padgi sir, Associate Professor, HOD, Department of Roganidana Faculty, Ayurveda, BHU. And in the afternoon session, we are having Dr. Prasanna Mogsale sir, Associate Professor, Department of Roganidana, SDM College, Ayurveda, Udupi. And next day, tomorrow, on 6th, we are having Dr. Ajanta Shivaji Kotekar sir, Professor, Department of Roganidana, SDM College, Hassan. And in the afternoon session of tomorrow, Dr. Samir Naik sir, Professor, Department of Kaya Chikitsa, Krishna Ayurvedic Medical College, Sankeshwar. We all welcome you, sir. Now I request Dr. Priyanka, PG Scholar, Department of Roganidana, to give introduction speech about the P.S. Padgi sir.
Good afternoon, everyone. Welcome to today's webinar session, first day. Myself, Dr. Priyanka C., PG Scholar, Department of Rog Nidan from Ayurved Mahavidyalaya, Hubballi. It's my immense pleasure to introduce Dr. Parmeshwarappa S. Badgi, sir. Sir, presently working as an Associate Professor, Head Department of Vikruti Vijnana, Faculty of Ayurveda, IMS, BHU, Varanasi. Sir is serving in teaching field since 17 years. Sir has completed his BMS degree in the year 1995 from Karnataka University, Dharwad, and completed internship from Ayurved Mahavidyalaya, Hubballi in the year 1997. Sir completed postgraduate degree from Calcutta University in the year 2000 and later joined for PhD in Kaya Chikitsa in the year 2001 and completed postdoctoral degree from Banaras Hindu University in the year 2003. Dr. P.S. Bhargi sir did his postgraduate work on Amavata and postdoctoral research on leishmaniasis both at BHU and CDRI Lucknow. Sir is advisory board member for International Journal of Research in Ayurveda and serving as an editorial board member of reputed journals of Ayush. Sir published 131 papers and 33 full papers in seminar proceedings. Sir also published 11 books and wrote 35 chapters in a book, and Sir guided more than 21 PG scholars. Dr. B.S. Badgi sir has received life membership certificate from AAPI, Indian Academy of Yoga. Presently, sir, working on the area that is relationship between genes, prakriti, and diseases, and their role in diagnosis and treatment. Sir, we're glad to have you with us today, sir. Thank you. Welcome you, sir, for today's session. Now the session is yours, sir.
Thank you, Priyanka. Over to Badgi, sir.
Okay. Thank you, Priyanka ji, for a nice introduction. Um, I think I am audible now. Is it audible?
Yes, sir. Yes, sir.
Okay. Okay. Thank you. I am very much thankful to Priyanka ji for your nice introduction. I am very much thankful to the whole organization, Principal Sir, Professor A.S. Prashant Sir, Professor J.R. Joshi Sir, Dean PG Studies, Dr. Raju Timapur Sir, Head of the Department of Roganidan, Professor Purnima Madam, and Dr. Mamtaz, Dr. Mahima, Dr. Ravi Verma, and Dr. Akshay Kumar, whole Sroto Anveshana team for organizing a very wonderful one-day webinar, national level seminar on Sroto Anveshana. So it is one of the important topics which needs to be understood from the understanding of the disease point of view. So understanding of the Srotas is very one of the important component. So one should go more focus on this. So how the what is the role of the Srotas in the development of the disease process, and the different Srotases and the different roles have been very well discussed in Ayurvedic classical text. So I will not go much in detail about the what are the Srotases. Everybody knows about that Sravana Srotamsi and the Srotamsi Kalu Parinama Mapadyamana Nam Dhatu Nam Abhivahini Bhavant Ayanartena. So these are all some of the references. But one more important sloka which I would like to highlight here. So what is Srotas? Srotas is one where in which Manaha, Prana, Anna, Paniya, Dosha, Dhatu, Upadhatuvaha धातूनां च मलामूत्रं मलमित्याभिधीयते मलमित्यादय तनो. So this particular Bhavaprakash sloka, I will come to this. I will come to the PowerPoint presentation later. So I'm just giving an introduction now. So what is Srotas? Srotas is the one where in which the mana carries, that's called as Manova Srotas, Prana carries Pranava Srotas, Anna carries Annava Srotas, Jala Udakava Srotas, Doshas Doshava Srotas, and Dhatu Srotas, Upadhatu, and Dhatu Mala, and the Mutra, Purusha, of which all these things are circularity, even the Matadev, Stano, the one, the Stanava Srotas are also included. So, in one particular sloka, where which discussed about the importance of the Srotas, what are the things which circulate inside the Srotas, and if there is any disturbance in the circulation of the mana causing the manovikaras, if there is a circulation in the prana that's causing the pranamavikaras, like that. So this Srotas is in that way, it's very important to understand. Along with that, there are references available in Charaka Vimanasthana, that is, see, though Vata Pitta Kaphas, which are circulating all over the body through Srotas. And if there is any problem in the Srotas, that leads to the development of the disease inside the body. So the Vata, Pitta, and Kapha are three important components. So these are circulating throughout the Srotas from 24 hours, and helping the maintenance of the body normal functions. But in the same, there are the behind certain things, similarly the things which are behind perception of the sensory organs, like mind and all those things, which move inside the srotas and are located in the sentient portions of the body. So healthy srotas perform their normal functions. As a result, body is free from the diseases. And unhealthy srotas, that is tadeta srotasam prakriti bhutatvat bhutatvan anna vikarai rupasrajate. If the unhealthy srotas, that leads to the development of the diseases. Along with that, there is a one reference which we get in the Astanga Sangra Shariristana. So that is the avakashas, or the empty space, or the srotas, which becomes, once they become abnormal, it brings abnormality in the other dhatus, because by not transporting to the required destination. So this is because the abnormality in the srotas. So the srotas vitiate the other srotas, and dhatu vitiates the other dhatus. For all these happening, so this disturbed dosas are the responsible factor. So dosas get aggravated by the disturbed functions of the Agni. That is why the one should give more due importance to the understanding of the srotas. Everybody knows about that. There are Bahya Srotas and Abhyantara Srotas. Any abnormality in the Bahya Srotas as well as in the Abhyantara Srotas, that is going to cause the diseases. So there are 13 Abhyantara Srotas mentioned by Charaka and 11 pairs mentioned by Susruta. There is a difference of opinion among these two authors. So what are the along with that? So when it comes to the explaining the certain diseases, certain srotases are also mentioned. So I compiled nearly 125 srotases in my book. You just go through it out. That is, other than this 13, so there are manova srotas, there are sangyava srotas, there are vatavaha, pittava, and kapava srotas, sabdava srotas, swaravaha srotas, and the Sarvavaha Srotas and Ojova Srotas. These are all some of the references which we get while explaining the Samprapti of the diseases. So in that way, there are very reference, very wide scatteredly descriptions are available in the other classical texts of the Ayurveda. So there are certain things which we need to understand about these processes. I will go into the slide presentations, PowerPoint presentation. Okay. Okay. I'm just opening the uh, PowerPoint presentation. Is it visible now? Is the PowerPoint visible?
Yes, sir. It is coming now.
Yes, sir. Yes, sir. It's coming now. Okay, okay. Thank you. So we'll just move ahead with the topic which has been given to me. So today I'm going to discuss
Yes,
about
sir.
the
Yes, sir.
important. Okay, thank you. So I'm going to discuss about the importance of Srotas in the manifestation of the disease, a
Sir,
critical
visible, sir.
understanding. Okay, okay. I'm presenting. So the today's topic which I'm going to discuss is about the importance of Srotas in the manifestation of a disease, a critical understanding. So there are references which are available related to the types of processes and all those things. So I will not go into the depth of it. So as I given
Yes,
in
sir.
introduction. So now I am talking about I'm discussing about the types of the what is the importance of process and how it has to be understood and how it has to be studied. So when it comes to the understanding of the srotases, you need to understand there are two different words which have been used in context to the understanding of the disease level. So what are those two terminologies? One is the Kavaigona, another one is the Srotodusti. So these two are an integral and indispensable stage in the development of a disease process, because until and unless the Kavaiguna takes place, so there won't be any manifestation of the diseases. So another one is the there are two different terminologies with the two different mechanisms taking place in the body at the different levels. So that is this Rutodusti is very frequently recognized and management is intended consequently. So because frequently recognized, because in the at the level of this Rutodusti there is an appearance of the signs and symptoms according to the dusti of that particular Srutas. So Kavaguna, its recognition, its contributor factors, its significance in treatment, and its consequence in the disease management is often ignored, because in certain conditions where there is a Kavaguna, but it does not causing any diseases, but it does not causing any symptoms also sometimes. So that is why it has been mostly ignored. But if it has been identified at this particular level, so that is going to be a very useful boon for the prevention of the further complications of a person. What is Srutu Dusti? Basically, everybody talks about the Srutu Dusti and the Srutu Vaikunyata or Srutu Vikruti, which is going to cause the causing the uh, causing the causes of the what is it is the base causes for the genesis of a disease, and their normalcy brings the health. So it is also caused by the aharasya viharasya sad dosha gunai samaha dhatubir vigunais chapi srutasam pradushaka. So it means the factors which brings abnormalities in the doshas and which brings the imbalance in the dhatus are the two important causative factors which are responsible for the development of the diseases. So that is why when it comes to the understanding of this, we should always be careful while managing the any disease, any cirrhosis. So you should identify the what are the those of provocative nidanas are there, and what are the those dhatu imbalancing nidanas are there. So accordingly, you should avoid that and manage the disease. So the in the classical texts of Ayurveda, where we don't get the word as such like Srutu Dusti, but there is a word is Srota Sampradushakaha. So that word is available in the Charaka Samhita while explaining the vitalogical factors for the uh, vitiation of the Srotas. So, as I mentioned earlier, there are different types of srotas mentioned in Ayurveda. One is Bhaya srotas and Abhyantara srotas. Bhaya srotas Vikruti also causes disease, and Abhyantara srotas Vikruti also causes the disease. And 11 pair 13 types Abhyantara srotas according to Charaka, and 11 pairs according to Sushruta. But other than these 13 types and other than 11 pairs, so there are srotas which I mentioned earlier while giving an introduction. So there are Swaravaha srotas, Vagvaha srotas, Jivavaha srotas, Doshavaha srotas, Indriyavaha srotas, Ojavaha srotas. So these are all the srotas which are mentioned, discussed while explaining the samprapti of the particular diseases. So that also needs to be understood. But to overall, so these 13 types of srotas are widely discussed, starting from the Moolasthana to that of the causative factors and the signs and symptoms of that particular vitiation of the Srotas and how it has to be managed. That those are all the things which are mentioned very clearly and classically. So the along with that, the when it comes to the, as I mentioned earlier, Srotasam Pradushaka Shabda word which has been used, but when it comes to the symptoms of each Sroto Dushti are presented, but Rasadi Sapto Sroto Dushti Lakshanas are not mentioned separately. But the acharas given in certain hints that they are nothing but the Dhatu Pradushas Vikaras only because they arise from the Dhatu Sroto Dushti. So what are the Srutasam Pradusaka or Srutasam Dushti Lakshanas? So that is the Ati Pravritti, it is an increased activity in anywhere. Maybe this Ati Pravritti may be in the gastrointestinal tract that enhances the increased bowel peristaltic movements and causing the Atisara and diarrhea. And in case of respiratory tract system, where there is an excessive secretions of the mucus secretions, excessive mucous secretions is again an example of atipravriti. So wherever there is an increased secretion from any part of the body, either the excessive secretion from the ear or from the eyes, anywhere where there is an excessive secretions other than normal, so that's called as the atipravriti. So the sangha is the obstruction which cause the blockage for the normal pathways of the components which are Srotams Ayanarthena Paranamamapadapama. So once they will have to move from transport the things from one place to the other through the channels. But if there is an obstruction, so that's not possible. That's going to be hindered, and that is going to cause the disease. And Sira Granthi, where there is an the architect of the Siras, the blood vessel structure, which is going to be getting disturbed, maybe because of the primary causes, maybe because of the secondary causes. So that is going to cause the again make an hindrances in the normal movement of the component. This is producing components or the components which are responsible for the sustenance and the growth of the body's cells and tissues. So Umarga Gamana is an opposite direction. So every tract or every srotas or every channel has its own pathways, and in according to that, accordingly those things has to come out from that particular respective pathways. But other than that, if that particular pathway is intermingled with other pathways, say for example, if the mingling of the Purushava Srotas with at of the Mutrava Srotas, so that is known as the example of the Umarga Gaman. So that mix, other than its own pathways, if it goes into the other tract and causing the disease process, that comes under the Umarga Gamana pattern. So what are the Sroto Dushti Lakshanas? As I mentioned earlier, Srotasam Dushti Lakshanan, these are the 4 types which I discussed, but these may occur either independently or in combination. There are diseases which manifest only by atipravritti. So, for example, in Prabhutavila Mutrata, where there is an involvement of the atipravritti of mutraka adipravritti. So there are diseases where the atisara, where there is an atipravritti, but there are diseases where there is a combination of both atipravritti or margagamana in case of the Swasaroga, where I mentioned earlier, so where there is an frequent excessive secretions of the mucus plug that's in the form of kapha, and then that's going to block the normal pathways of the prana vata, and then that is causing the umargagamatva of the vata, and that is resulting into the difficulty in breathing. So like that, so there are involvement of the 2 or 3 srotases together, or in certain individuals where there is an all the 4 types may be there, that we can find it in case of the Vyadi Sankara condition. So among the 4 types of the Srutasam Dushti Lakshanas, so majority of the diseases where the Sangha is one of the very important Dushti, and that is going to cause majority of the diseases. So what is the close association of the dhatus with that of the srotases? Is the association of the dhatus and srotas is dhatus and their respective srotas generally share a very close association. So as a result, there is an development of the pradoshata, or the dusti in that particular srotas leads to dusti in the dhatus and the vice versa. So as I mentioned earlier, the while explaining about the srotas, if there is a vitiation of the srotas, so that will the vitiated srotas is not capable of transporting the parinamamapada dhatus from one place to the other. That brings an abnormality in the dhatus, and then dhatus again visit the other dhatus, and then for all these things, the dhatu dosha dusti is one of the important factors. For again, finally, Acharya Vagbata says that for everything, Agni is the main culprit. So if there is an Agni dusti, that's going to cause the abnormality in the doshas, abnormality in the dhatus, abnormality in the srotas also, and causing the diseases. So Sroto Dusti means that there is a vitiation of the Srotas leading to the many abnormalities in the Srotas, and it is due to the abnormal doshas and the dushas. That is the main etiological factor. So once the dosha samurchana happens in the Srotas, it causes the Srotodusti, resulting into the development of Dhatu Pradoshaja Vikara, Indra Pradoshaja Vikara, or Dosha Pradoshaja Vikara, if it is in Mana, it is Mano Pradoshaja Vikara, if it is in the Shabda, Vagvaha Srotas, and Vagvaha Vikaras, wherever, if it is in the Vojavaha Srotas, it is in causing the Vojavaha Sroto Vikaras, like that. So wherever there is a Samurchana is taking place in whichever the Srotas, so that is going to cause the disease inside the body. So while circulating doshas and the dushas, so that is why in the Kupitanami doshanam shariri paridavataha yatra sangaka vaigunyat vadis tatropa jayate. So that was the definition given in the Susrita Samhita. So where they circulating these doshas and dushas, where if they will normally in normal srotas they will circulate normally inside the body and they perform the normal functions. But if there is an kavagunyata, there is an obstruction, or if there is an abnormality, or if there is an vitiation in the srotas, so that will favor the development of the sthana samshraya, and then that leads to the interaction of the doshas and dushas in one particular site and causing the disease process. So the stage of interaction between the dosha and dusha and its consequent reactions might be considered as the Sroto Dusti, because the Sroto Dusti is the resultant actions taking place after the amalgamation of the doshas and dusas in one particular site, and that will exhibit certain clinical signs and symptoms. The phase of Kavaigunda and Srutu Dusti are taking place in the stage of the Sthana Samshaya itself. So the Kavaigunda, as mentioned in Charaka Samhita, Vani ne Rasadatur, that particular sloka, where the Kavaigunda is vividly discussed in the classical text of Ayurveda, and then this particular Vanavata, which impel the Ahara Rasa, that is the final product of the digestion, through the Hridaya to the whole body. And while circulating the propelled rasa that lodged in the region of the susceptibility, that's Kavaigunda, leading to the development of the diseases. So, Yatra Tishtati, like that such references are available. So, Susruta Samhita, where he mentioned that Kupita doshas which circulate all over the body and produces diseases when they come across the seat of the susceptibility, that's the Kavaigunda. So, this Kavaigunda and Sroto Vaigunya. So there are references which in Dalana commentary and the other commentators has been clarified that the word Kavaigunda is described as the Sroto Vaigunya, and the in commentary of the Chakrapandi. But in Dalana commentary and Arunadatta also express the Kavaigunda as the Sroto Dusti. But in the Ashtanga Hridaya, where well Arunadatta commentary, where we got the references that so this the Kavaigunda is equivalent to that of the Sroto Dusti. So that references which are available. So Kavaigunda, if you define this word, Ka refers to the Srotas and the Vaigunda refers to the Vigunata in the Srotas is known as the Kavaigundata. So what is that Vaigunyata or Vigunata which is taking place inside this Srotas? So that is, there is any deviation from its normal karma, that functions, and guna, that's characteristic properties, is known as the Vigunata. So that is, if there is any abnormality and in the function, in the karma of that particular Srotas, or the guna of pertaining to that particular one, that is known as the Vigunata in that. So Vigunata, abnormality of the Srotas, may be broadly classified as Karmata Vaigunyata or and the Gunata Vaigunyata. So this Karmata Vaigunyata may be brought about by the Guna Vaigunya of the Srotas, Dhatvagni Mandya or Ruddhi, or influence of the Purva and Paradhatu and the Ama. So this Karmata Vaigunya may be because of many factors. So it is brought about by the Vaigunya of the Srotas, Dhatvagni Mandyata or Dhatvagni Ruddhi, influence of the Purva and Paradhatu and the Ama. So we'll discuss one by one. So Guna Vaigunya of the Srotas, in case of the, for example, in case of the Bija Dusti, the Srotas become either anatomically or functionally abnormal, and as a result, it cannot carry out its normal function. So because there is a defect in that particular Srotas. So Dhatvagni Mandya or the Dhatvagni Ruddhi, where in case of the Dhatvagni abnormality, the conversion inside the Srotas is incomplete, leading to a Samadhatu or Dhatu Ruddhi or Apakva Dhatu Utpatti. As a result, abnormality inside the Srotas occurs, leading to the Karma Vaigunyata. So Purva, that's previous Dhatu, and Para, that is subsequent Dhatu. If Purva Dhatu is Sama, improperly Sama, improperly converted, the Uttara Dhatu, subsequent Dhatus will also become Sama, because Purva Dhatu has an influence on the Para Dhatu. This has been well discussed in classical texts of Ayurveda. In the Purva and Paradhatu, examples are like, Samarasa resulting in Utpatti of Samarakta Dhatu and so on. Due to improper Poshaka Amsha, Ahara Rasa, essential nutrients, the Srotas that the channel, that the channels, the pathways and the karma of the Uttara Dhatu also becomes abnormal. So for example, the leakage from the gutter pipe or sewage pipe and released into the water supply pollutes the whole drinking water. In the same way, if there is any defect or leakage in any of the Srotas, so that will lead to the abnormality in the other cells. So the development of Ama either by Jatragni Mandyata or by Dhatvagni Mandyata is the main culprit to cause the obstruction inside the Srotas. So the word Ayanarthena, which has been used in context to the Srotas, this signifies the channels of circulation do not carry the Sthira Dhatus, but only such of the mobile Dhatus are destined to be transformed to another Dhatu situated elsewhere are carried by them. So this hollowness or this Saushirya is the characteristic property of the Srotas. Due to presence of Ama in the normal characteristic property of the Srotas will no longer be present, leading to the manifestation as a result, Karma Vaigunya, or that is the abnormal functions occur. So ultimately, Vahana, transportation of the Parinama Mapadhyadhana Dhatu, ultimate end product of the digestion, will be interrupted. So Guna Vaigunya, anatomical and physiological defect. So Prakrita Guna of the Srotas, the orifice of the Srotas are very small, wide. This is the description of the normal description of the Srotas, which I am explaining now. Long and far, and like those in the lotus stalk throughout them, and nourishes the whole body. The color and form of the Srotas would be similar to that of the Dhatu. They transport and they may become cylindrical, either Tula, they become gross or macroscopic, or Anu, maybe an anatomical or microscopic, Dirga or Pratana. So this is the normal structure of the Srotas. Any divergence from the above qualities, if there is any divergence of these above qualities, is the Guna Vaigunya of the Srotas, and that is the change in the structure of the Srotas, causing the abnormality and defect in the normal function. So Bija Dusti, for example, genetic defect, the characteristic structural property of the Srotas is predetermined by the excellence of the genes, and defective gene may cause anatomical and physiological deviations and defects in the Srotas that leads to the development of the abnormalities in the body. So there's a defective formation of the dhatus also. Defective formation of the dhatu by any means leads to the vitiation inside the Srotas. The Srotas the same as Sroto Vaigunya is there are questions, there are queries, there are discussions in the classical texts of Ayurveda, as well as in some of the books also. Some people have narrated that each Srutu Dusti and Kavagunya are the similar terms or the different terminology. As I mentioned earlier, the word Kavagunya is used by the two different acharyas while explaining the diseases. They use the word as Kavagunya, Yatrtistati, and Kavagunya, Vyadistatropajayate. So these are all the words for the manifestation of the diseases. Sroto Vaigunya or the Kavagunya is the conjunctive factor. So in that way, the words Kavagunya and Sroto Dusti are appears to be similar. But some people of the opinion is that Kavagunya may perhaps be considered as a precursor to the Sroto Dusti. Some are saying also that Sruta Vaigunya is less severe and only functional deviation and will not cause a disease, but may predispose for many disease manifestation in the later part. Whereas the Dusti in the Srutas is a severe form of the Sruta Vaigunya and will certainly cause a disease and exhibit the clinical features. But if the Kavaigunya and Sruta Dusti are identical, if it is believed that there is an abnormality in both the cases to a certain extent, in varying degree, that's important, then the Dusti in Srutas would give rise to appearance of the symptoms and signs Srutu Dusti Janya Lakshanas or Pradoshaja Vikara of the respective Srutas. So it is not essential that a disease has to be present. Wherever there is a Kavaigunya, if it is thought to be milder or degree of Srutodusti, on the contrary, the Srutodusti surely cause the manifestation. On the contrary, the Srutodusti surely cause the manifestation of the diseases. But the Kavaigunya may not be capable of producing the diseases in certain conditions. So to differentiate these two, I made a table of it. So that is the Kavaigunya is manifest before the some people says that it develops before the dosa Samurtina stage, or some people says that it makes the favorable environment, but the Sruto Dusti develops after the dosa Samurtina. So this is the before that, and once this is the Sruto Dusti is after the dosa Samurtina. So Kavagunya is the place where it favors the dosa Samurtina. So it's the before the disease, before the dosa Samurtina, and it is necessary for Sthana Samsriya Asta of the Kriya Kala. It is necessary. The one the Sruto Dusti is necessary for the Vyakta Asta of the Kriya Kala. So it may manifest minor etiological factors, but it may manifest complex etiological factors or disease-specific signs and symptoms. So this state may interfere the state of the Anumana Gamya Bhava. So because there won't be any classical features are mentioned at this particular stage, developed at this particular stage. That's why Anumana Gamya Bhava. But it may manifest a complex etiological factors and the clear-cut signs and symptoms of a disease. So Pururupa may be seen in the stage of the Kavaigunya and in the state of Srutodust. Once the Srutodust submersion is complete, it develops the development of the signs and symptoms of a particular disease. So dosha sanchaya, prakopa and prasara lakshanas are observed in Kavaigunya stage, but in case of the Srutodusti, there is an Atipravritti Sangha, Siragranthi and Vimargagamana Lakshanas are seen in the stage of the Srutodusti. So the primary and secondary Kavaigunya are the two important causative factors to cause Srutovaigunya. So the creation of Bija Dusti Janya Kavaigunya is due to the influence of the defective genes, because in the primary disorders where there is an defective gene which is responsible for the development of the defect in one particular Srutas, and that's going to cause the disease. In case of secondary Kavaigunyata, results due to the deeds done by the individual, maybe faulty lifestyle, faulty dietary habit, like alcohol, smoking, and exposure to the smoke, dust, and all those things. These are the factors which may be responsible for the Kavaigunyata, secondary Kavaigunyata. Maybe in certain individuals where there is a primary and secondary together will cause the severity of the disease. So the secondary Kavagunyata is resulting because of the deeds done by that particular individual, as I mentioned earlier. So, take for example, I can quote some of the examples of the modern medicine, which we can correlate. The metaplasia and dysplasia, when in their initial stages, when they are clinically silent, they are very near to the concept of survival, because there is an there is an Kruti is there in the Srotas, but it's not capable of producing the diseases. But when these conditions when start presenting with clinical features, so that will indicate that Sroto Dushti has taken place, and that will favors the development of the disease process. So capillary endothelium permeability abnormalities. For example, if there is a change in the capillary endothelium permeability relates to the stage of Kavagunya, because which causes the development of the gaps between the endothelial cells and consequently leads to the development of edema or into the clinical presentation of the inflammation in association with the hemodynamic changes through the mechanism of increased vascularity, cellular events, etc. So, and these pathological events correlate to the Sroto. So, impaired venous drainage. The process of development of obstruction in the venous drainage relates to the Kavagunya, and the further steps to the Sroto, which are associated with the clinical presentation of the respective vein abnormalities. So the anaphylactic reactions. So this process of development of anaphylactic reactions also clearly demonstrate the presence of the two stages of Kavagunya and the Sroto. The first is the contact with the antigen, in which sensitization of the body takes place by the circulating B lymphocytes, which differentiate into the IgE secreting plasma cells, and the secreting IgE antibody binds to Fc receptor of the mast cells and basophils, making them fully sensitized for the next event. So whole of this process stated above main part, priming the body for the anaphylactic reaction, is like the described concept of Kavagunya, which alters the inherent properties of the body and its channels, predisposing them to the disease development. See, the development of anaphylactic reactions, the latest stage of the second exposure of the antigen and its consequence, which presents with clinical features of anaphylaxis, is the state of resembling the Sroto concept. So, the genetic and nutritional diseases, here also the concept of genetic and nutritional diseases also relate to the concept of Kavagunya, through defective formation of the tissues, which predisposes the individual to the development of certain kinds of diseases through the process of Sroto. Similarly, there is a nutritional deficiency, and disorders also cause formation of the tissues deficient in quality, and thus Kavagunya, which results the further Sroto and causing the diseases. The atherosclerosis, the whole process of development of the atherosclerotic plaque correlates to the concept of Kavagunya, and the further consequence of the rupture, infarct, thrombosis, etc., which develop the clinical presentation as discussed in context to the Sroto. Because the atherosclerotic plaque, which they are developed, if they are very small in size, so it is not going to cause the disease. But if it is become bigger, and if it become ruptures, and if it become infarct and thrombus, and that the size becomes growing day by day, and if it is capable of causing the obstruction in the sources, so definitely that's going to make and in the development of the disease by making the Sroto. In the thrombus also, the pathogenesis of thrombus comprises of various events before the actual formation of the thrombus. So endothelial injury is a state of Kavagunya which predisposes the vessel to the development of thrombus through the initiation of other steps as platelet activation, activation of the coagulation pathway, and alteration of the blood flow, etc. So the development of the thrombus related to the concept of Sroto, which manifests with the classical clinical presentations in the body, so depending on the site of the thrombus where the Vikriti is there. So the importance of the knowledge of the Kavagunya in the Chikitsa, the knowledge of Kavagunya is very necessary while planning the Rasayana Chikitsa, because the Rasayana Chikitsa or Apunarbhuva Chikitsa preventive treatment modalities, because that can be prevented at that particular stage by avoiding the etiological factors which are responsible for the Kavaigunya, and and then initiating the line of treatment, so to prevent the further development of the disease process. So hence Rasayana treatment for the prevention of the disease as well as the disease specific mentioned in the classical text to correct this Sroto so that the disease won't manifest again. So while planning the Rasayana Chikitsa, Rasayana targeting a particular Srota should be preferred, so that so that it targets the Kavaigunya, hereby correcting it so as to prevent the recurrences. So uh, this is about the various kinds of the importance of the Srotas and and its role in the development of the disease process. So for each and every Srotases, there are different kinds of Srotases. For each Srotases, there are the Moolasthana, there are the common etiological factors, there are signs and symptoms, and according to the treatment lines are also been mentioned. So this is about the importance of Srotas in the understanding of the disease process. So now it is open for the questions. If anybody is having a questions, you can ask the question. Dr. Mamtaj,
Yes, sir.
you can go ahead with the questions and answers if any.
Yes, sir. There are questions, sir.
Okay.
What is the significance of Shrotas in the present scenario?
Okay. In the present scenario, if we talk about the COVID crisis, so in the COVID crisis is where it is disease of the Pranava Srota Vikar, where in this there is a predominance of the Kapha and Vata, both are taking place. That's what I told earlier while explaining that. So there is an increased secretions of the mucus, so that makes an formation of the mucus thread in the Pranava Srotas in the respiratory tract, and which makes the blockage in the respiratory tract, and then that is resulting into the development of the swasa. Even the coronavirus, the COVID-19, SARS-CoV-2, which initially targets only the lung, only the throat in the initial phase, and later which spreads to the lungs. Once it spreads to the lungs, then that needs to be managed with appropriate treatment modalities. Even then, there are no treatment modalities, but you should prevent the further damage of the lungs and other systems by preventing the more viral load. So, in the present scenario, understanding of the Srotas is very important. So, you should understand the Swarava Srotas is also involved in this. So, give importance to the Swarava Srotas and take care at that particular level itself. So, then once you take care at that particular level and initiate the preventive measures in the form of haldi, sandavalavan, and warm water gargling, so you can prevent the further progression of the disease. But if the care is not taken at that particular level, then it progresses to the further stage of the then it may enters into the lungs and causing the life-threatening condition, and it may lead to the death of an individual.
Thank
Mumtaz?
you, sir.
Okay.
Thank you, sir. One more question. Why Shushruta excluded Madhya Astivaha Shrotas?
There are three Srotases which are excluded by Susruta, Astiva, Madhava, and Svedava Srotas, because while explaining that, he told that it's not possible to explain the Srotas which are pervaded through entire body. So because he was more being a surgeon, he was not mentioning the Sroto Lakshanas, he was mentioning of the Sroto with the Lakshana. So considering the Sroto Vidyata and the overall, because it spreads to the different whole, because these Srotasas are pervaded to the entire body, so that is why it is not possible to explain the Sroto with the Lakshana, with the Sroto Vedda Lakshana. So that is why these three Srotasas are not mentioned. That is the one reason. And another reason is the Medo, there is a relationship between the Medo Vasrotas with that of the Sveda Vasrotas. So that is why, that because already I mentioned this Vedava, and that's the reason he was not mentioning about the Sveda Vasrotas. So it is mainly because of these three Srotas are pervaded through the entire body, and it is not possible to explain the Sroto Veda Lakshanas of these Srotas. So that is why these three Srotas are not mentioned in the Samhita, in the Sruta Samhita, but he mentioned he mentioned the Srotas of these while explaining the Samprapti of the diseases. But when explaining about the 11 pairs of Srotas, he excluded these three because he was targeting only about the Sroto Veda Lakshana. Mumtaz?
Yes, sir. Thank you, sir. One more question.
Okay.
Can we take Sangha as a functional obstruction and Shiragranthi as an anatomical obstruction?
Yeah, that's what I told, that while explaining about the I think I was talking about the I was explaining about the there are two kinds of karma vigunata and karma, and that I clearly mentioned. So there are functional and the structural abnormalities. There are structural vigunata and the functional vigunata, which are responsible for the making the abnormalities in the um, Srotas. So that is the reason while explaining about the Vigunata, so I use the word, two different word, Karmata Vaigunya and Gunata Vaigunya, because this Karmata and Vaigunya, and because in case of the Siragranthi may be a structural abnormalities, that may that is responsible for the development of, like, coarctation of the aorta, aneurysms, or even the hemorrhoidal pause. So these are all some of the examples of Siraj Granthis, or maybe an varicose veins. These are all the examples where there is structural abnormalities. But in other conditions where there will be a functional karmataha vaigunya and gunata vaigunya is taking place in the srotas, and that may be causing the disease in the individual. So that I explained while I was explaining about the vaigunya or vigunata of the srotas.
Thank you, sir. Next question. Mainly, which Shrutas is involved in the hypertension, as it is Rasa or Raktava Shrutas?
Uh, Actually, there are theories, there are hypotheses, because hypertension is such correlation words which are not available in the classical text of Ayurveda. But there are references which indicate the Rasava Srotas involvement has been highlighted, because see, while explaining about the Vani and Rasadaturhi, so that particular sloka where where it has been mentioned that, so this through Rudaya, so this through the Vanavata, so this Rasadatu is circulating all over the body, and wherever it goes and obstruct, and then this Vanena Rasadaturhi Vikshupachita Karmana Yugapat Sarvatru Ajastra Deham Vikshipete Sada Shipamanaha Ka Vaigunyadratha Sajati. So in that particular way, so where there is an obstruction in the abnormalities in the Vigunata in the Rasavasputas, so that brings abnormalities, and that is causing the hypertension, abnormality because of the Rasavasputas. In case of Rasavasputas, is the main culprit in case of the hypertension. But in the advanced conditions of the in the advanced condition of the if it has not been managed in the initial stage of it, but later there is an involvement of the Raktavastrotas also. So there is a combination of both, because this rakta which is circulating inside the srotases and in normally, but if there is a vaigunyata is there in the srotas, because of the continuously exerted pressure on the walls of the arteries, that will leads to the diffusion of the Raktava Srotas also. So there is an involvement of both Raktava and Rasava Srotas in case of the hypertension is observed.
Yes, sir. Thank you. One more question. Which organ can we correlate to Vama Parshva, which is Annava Shrotas Moola?
Uh, Actually, when it comes to the explaining about the Annava Annamaha Srotas and its correlation with the so when it comes to the Pranavaha and Annava Srotas, so there is an Vama and the Parshva, there is an Vama Parshva. So there may be and the organs which are involved, which will help for the assistance of the maybe in the form of the gallbladder and its secretions which are helpful in the normal digestion activities. So those things can be taken into as the Vama Parshva there, where the organs which assist in the for the these things, like so there are the bile secretes from the gallbladder, and that may be considered as the Vama Parshva, and that may be taken into consideration.
Yes, sir. One more question. Cloma means which organ in related to Udakava Shrotas?
There are queries, there are discussions which are taking place in context to the Cloma, in context to the Udakava Srotas, but uh, there is an there are queries, but in my opinion, from Rognidana point of view, it should be taken as the pancreas and beta cells of the pancreas, and because there is any abnormality in that particular organ, that leads to the Udakava Srutu Dishti Lakshanas, because in the Udakava Srutu Dishti Lakshanas, where the dryness of the tongue, palate, lips, and there will be an thirst. So these are all the things, the clinical presentations which indicate there is an pancreas is one of the best correlation, beta cells of the pancreas, which we can correlate with that. If there is any abnormality in that, so that cloma may be considered into that. Because some people are saying that cloma may be with that of the lungs or some other body parts, but from the Rognidana point of view, based on the clinical presentations, it may be compared with the pancreas, beta cells of the pancreas.
Thank you, sir. One more question. Understanding of Shroto Vaigunya in Gulma disease.
Of course, there are diseases which very difficult to explain the involvement of the these things. But the the gulma is a diseases of the Annava Srotas. So that is why we can say that there is an involvement of the uh, there is a development of the abnormalities taking place inside the Annava Srotas, maybe at the macro level, maybe at the micro level, maybe Stula Srotas and Sukma Srotas, which are pertaining to that. Because if there is an Mahasrotas, but again in the Mahasrotas, there are Sukma Srotas which are there, and those Sukma Srotas which are responsible for the release of the essential enzymes, release of the essential secretions that will assist the proper digestion and all those things. So, if there is an abnormality in that minute processes in the gastrointestinal tract, so that will leads to the development of the gulma, paripenditatvat gulma. There is a development of the rounded structures in the intestine, mahasrotas. So that is why there is an in mahasrotas, yes, of course, but there are Sukmasrotas which are present in the Mahasrotas, that there is an abnormality in that will cause the Paripinditatvat, that rounded structure which is going to develop inside the Gulma Vikar. So Gulma is basically developing because of the annava srotas, but mahasrotas, and again the minute srotas or the sukshma srotas or the anu srotas which are there inside the mahasrotas, and those abnormalities will cause the gulma. That's why gulma clinical presentations are sometimes will be hampered. But for the management, there is a lot of emphasis has been mentioned to give an importance to the agni. So in that way, we can say that so there is an involvement of the annava srotas in the gulma roga.
Yes, sir. Any disease in which all Shotodushti karanas are present. Is
Uh,
there any such disease?
Take for example, as we mentioned, there are certain diseases where most of the Asta Mahagada Vikaras, Asta Mahagada Vikaras, where we get in all Asta Mahagada Vikaras, you find all these things. So, because in the initial stage, these diseases will be presenting their clinical presentations, but later these Asta Mahagadas will developing the complications. So, in that particular stage, there is a involvement of both all the four conditions will take place in the form of the take for example in case of cirrhosis of liver, where you will get all kinds of the patient develop that particular stage, where you will get all the four. So when in the diabetes mellitus also in the initial stage, but once it is advancing, then there is an involvement of all the four stages. So the even in the cancer also, where initially in the initial stage only the atipravritti, because excessive and unwanted purposeless growth of the cells takes place. But if it is bigger and bigger, and because then the cell size and cells of the cells is becoming bigger, and it causes the obstruction. And then once there is an obstruction, and then there may be because of that obstruction there is a marga gamanatva that things takes place. And these are all the some. Then there may be the Chiragranthi also. So in that particular conditions, where the advanced malignancy conditions also, where you will get the this all the four. So that is why in one line we can say that all the Ashtamahagadas, where you will get this all four abnormalities in the later part of it.
Yes, sir.
Okay.
In varicose veins, which type
Okay.
of Shotodushti is seen and what is the line of treatment?
In the varicose veins, I was quoting the example of this venous abnormalities, where it is basically and there is a defect in the veins, and that will the example of the Sira Granthi. So there is an classic example we can say that. So, but when it comes to the treatment point of view for the varicose veins, so in the there is a structural abnormality. So that structural abnormality needs to be corrected. Nowadays, there are advanced surgical procedures are taking place. Nowadays, the people are undergoing surgeries, but still there are successful, and there are success, and there are unsuccessful. But in the from the Ayurvedic point of view, you should identify whether it is karmata or karmata vigunata, as well as the structural vigunata is there, rachanatmaka vigunata. So accordingly, then you need to start with the initially there are prachanna, rakta visravana, or jaloka vidhi, and this can be tried in the initial phases of it. And if they are able to correct it out in the initial phase of it, it's well and good. But otherwise, if it is not corrected with these measures, then it's an purely a surgical condition that needs to be the surgical intervention are necessary to correct the varicose vein.
Yes, sir. Thank you. One more question. How Mamsavaha Shotas involvement is there in the causation of Kushta and Prameha?
Oh, okay. There are in the Kushta Visarpa, there are Saptavida Dravya Sangraha. There are Rasa, Rakta, Mamsa, and Lasika. And the three doshas, Sapta Dravya Sangraha. In case of Kushta, but in case of the Prameha, there are 13 dosha and dusha, three doshas and 10 doshas. So except Asti Dhatu, all the six dhatus are involved. Vasa, Ambu, Lasika, and these are all uh, uh, involved in that. So the mamsa is involved in both the conditions, because there is a development of the pidakas, development of the pidakas which are taking place, the skin manifestations of the skin eruptions, which are taking place by making the samprapti by the dosa dosa samurtina in the throtas, especially in the mamsava throtas, and thereby they are causing the there are various kinds of the skin manifestation. So then that's the reason you will get the secondary infections, and the diabetic patients, diabetes mellitus patients are very prone to develop the candidiasis infections and the bacterial infections and the arterial rashes, and then some they're very prone to develop the dermatitis also, the simple bacterial infections also, when they exposed to these positive agents. But in both the conditions, the mamsa is involved, because even in the diabetes in the diabetes mellitus also, initial phase. But the diabetes mellitus cannot be diagnosed until and unless it has been mentioned in the text that until and unless 80 to 90% of the beta cells of the pancreas is damaged, there won't be any manifestation of the clinical presentation. But the patient, some patients will present with the non-healing of the wounds, and then repeated fungal infections, and the skin, the patient will expose to the repeated GI tract disturbances, skin manifestations. So based on this, we can say that yes, there is an involvement of the mamsosrotas in the initial phase of the disease, and that needs to be taken care in the initial phases of it, and that needs to be managed with the appropriate uh, treatment modalities.
Yes, sir. One more question. Whether Kavaikunyata is the main cause for the disease or dosha visheshan is the cause?
See, there are it's in train. That's what I told in the best example I told from the Ashtanga Sangraha in the initial phase of my introduction. So everything is again dependent on the Ashtanga Sangraha says that everything is dependent on the Agni Dushti. So if there is an Agni Dushti is there, a Dushant Agni Dosha. So the first one is if there is a defect in the srotas, then that defected Srotas is not capable of transporting the dhatus from one place to the other place, resulting into the defect in the dhatus. And when that dhatu is causing abnormality, causing the defect in the other dhatus. For all these things, we see the doshas are responsible. But again, for all these things, again responsible. Then these dosa aggravation, dosas are get aggravated by the. That's what sarveshameva dushayitaro dushta doshaha teche prayasho dushant agni dosha. So for all these things, so agni dosha is the main culprit. So that's why in Ayurveda it has been mentioned that you do importance to the agni, because agni dushti causing the dosha vitiation, that causing the abnormality in the dhatus, that causes the abnormality in the srotas, and that srotas which is not capable of transporting the from one place to the other place because of the kavagunyata in that particular place. So that's why the Agni Dushti is the main initiating factor for the development of the any disease process. That has been clearly mentioned in Astanga Sangra Sarira 6/30.
Yes, sir. One more question. Why Acharya Shushruta explained Marana as with the Lakshana of Mamsavaha Shrotas and not for Raktavaha Shrotas, as he considered Rakta as fourth dosha and Prana?
In my opinion, because the deeper dhatus, where there is if it goes to the deeper and deeper dhatus, where there will be an so mamsa is considered as, because he considered it as an one of the um, what is that marmas. So in that way, considering it as a marma, so that is why he mentioned it as the uh, maybe that may be the reason Mamsavaha Srotas, maybe because its Mula are the Snayu and the Twak. But even again, some there are references in the Sushruta Samhita itself. So this Mamsavaha, Mamsavaha Srotas, where its Mula is Snayu Tvacha and Raktavaha Nesta Damana. So that is why, because of this, the Raktavahi Damanis are the Mula Sthana for the Mamsava Srotas. So that is why he told that because of that there has been Marana is taking place because of this. So that was the reason Susruta has mentioned the Vidyasya Sveto Mamsam Soshaha Shira Granteho Maranam. So that was the reason he mentioned because of this.
One more question, sir. Last.
Okay.
How to use modern technologies like X-ray, CT scan, and MRI to rule out Sroto deformities?
See, nowadays, this is very, very important because the pyrometry is one of the very important components to assess the Srotas abnormalities, because that will help you to understand the obstruction level. So, how much obstruction is there? So, pyrometry findings are very, very important. That will help for the assess the obstruction in this thing. So even the endoscopy is also very, very important to assess the gastrointestinal abnormalities or any obstruction in that. So the usage of the tools is very, very important. Even the X-rays also very, very useful. Because any abnormalities in the X-rays, for example, if there is a pleural effusion conditions are there. So wherever there is a pleural effusion, so that is causing the obstruction there. So that's the usage of the tools, modern tools is very, very important for the assessment of the any abnormalities. Take for example, if there is an the whether that there are ascites is causing, because either maybe because of malignant conditions of the GI tract, or if there is a tuberculosis of the intestine, or peritonitis. So, or it may be an cirrhosis of liver. So that can be understood by the usage of the technologies in the form of ultrasonography or CT scan abdomen. So the latest technology will help you to understand where exactly what exactly the structural abnormality or the functional abnormalities which are taking place inside the Srotas. So understanding of the abnormalities of the Srotas very minutely through the use of the modern tools and techniques are very, very important. So that will be very, very useful to diagnose the various conditions.
Okay, sir. Uh, Thank you for answering every questions. Thank you very much, sir, for
Thank you.
enlightening us with your vast knowledge in
And
Roganidana
I
and
think
one particularly, sir.
it's a 2 days program, no?
Yes, sir.
2 days
Today and
program.
tomorrow.
Okay, okay. So, is there any panel discussion where the question and answer can be taken again?
No, sir. It's over now.
Okay,
It's completed.
thank you, thank you.
Yes, sir. Thank you. Thank you, sir. Thank you for joining us for the Sroto Anveshana first session. And at 3 to 4 o'clock, we are having second session. Please join us.